Good evening, everyone. So we're just going to give everyone a few minutes to enter the Zoom. We do have a few housekeeping reminders. Please keep your mic muted. Shalini, do you mind changing the slide for me? Perfect. Please keep your mic muted. Video is encouraged, but not required. Please use the chat feature to ask any questions to the panelists, and this session is being recorded.
As everyone is joining, I just want to remind you there'll be a link on the chat for you to fill out a Google form. So just keep an eye out on that.
Okay, I think we're gonna go ahead and get started. So first and foremost, I would like to thank the panelists and the audience members for taking time out of their probably Zoom-filled day to join us tonight on this webinar. This is the second student-led webinar that the Beyond Flexner Alliance Student Assembly has put together. This time we partnered with the Physician Assistant Education Association, PAEA. Just to briefly introduce myself, my name is Tiffany Lacroix. I am a current third-year student at the CUNY School of Medicine, Sophie Davis Biomedical Program. I'm also an intern at Beyond Flexner Alliance, and I am your co-moderator for the evening. Now I'm going to turn it over to my co-moderator, Maria.
Hi, everyone. My name is Maria. I'm a second-year physician associate student at Yale. I'm also a student health policy fellow for the PAEA. I'm very excited to be here.
Thank you, Maria. I'm also very excited to be here. Just to briefly let you guys know what we're going to be doing during this webinar. First, we're going to talk a bit about the Biden-Harris administration and what they already have in place for the first 100 days. We're going to learn more about our panelists and the voting initiatives that they've been a part of. Then we're going to move into the panel discussion. We will have a 5-minute intermission in between the discussion, just so that you can walk around, get some water, anything like that. And then finally, we'll end with questions from the audience. So just please make sure to hold your questions to the end if you want to speak them out loud. If not, you can definitely type in the chat throughout the webinar. And so what is this webinar about? Why are we doing this, right? So we wanted to create an interdisciplinary safe space where health profession students can come together and learn from each other, bring about awareness to certain issues that are impacting health professions education, and basically form a space where we can brainstorm how to better mobilize our respective institutions. Our end goal specifically for this webinar is to send a letter out to the Biden-Harris administration on what health profession students hope to see. And now, Maria, do you mind going over what the Biden-Harris administration has in the works for the first 100 days?
Absolutely. And by no means is this everything. It's just a few notes I took, to set some context for the conversation we're going to have. So as probably a lot of you know, Biden has said that he wants to build on the Affordable Care Act, such as expanding the subsidies for premiums, restoring funding for consumer outreach, and helping with signups. So he really wants to go back and expand on the work from the Obama administration. I think Biden also wants to keep private health insurance, but also introduce a public option that would compete with the private insurance and serve as an alternative plan choice. You know, it's a little bit, it's not quite insurance for everyone, but it's a little bit more liberal from what his opponents were advertising. In terms of COVID, as we all know, he put together an advisory board of 13 health experts, and he's continuing to promote masking, distancing, contact tracing, hand washing. He's already said that he plans on releasing all of the available COVID vaccines that we have, with the idea that the second dose will be made available in time. And he has also promised that he would use Defense Production Act to ramp up the production of PPE if that is needed. In terms of Medicare and Medicaid, the Biden administration plans to expand eligibility, so making Medicare enrollment at 60 instead of 65, and making dental, vision, and hearing coverage standard issue. And something else that Tiffany will also expand upon is expanding coverage to DACA recipients and allowing undocumented immigrants to purchase plans in the Affordable Care Act marketplace without federal subsidies, but still allowing them to go into the marketplace. So those are just some of the initiatives that they've been promoting.
Thank you, Maria. So I think the only thing I have to add, I think you did a great job, is that he also has plans to, or the administration also has plans to kind of reverse the rule on immigrants being dependent on the US government. So changing up the public charge rule that's put in place currently. But I think that's pretty much all I wanted to add. So we can definitely go into our Q&A portion, and Maria, you can lead us into that.
Sure. So it's with great pleasure that I get to introduce our panelists, although I'll let them give a more in-depth introduction. I love that we have a little representation from different healthcare fields. So I want to introduce Anthony. He's a physician assistant student at Midwestern University, the Glendale campus in Arizona. We have Jonathan, who's at Harvard Medical School. We have Caroline at St. Louis University in the physical therapy program, and Vishnu, who is at Florida Atlantic University. He's a medical student, and I've already told me that have much nicer weather than we do here in Connecticut, so I'm very jealous. So Vishnu, actually, if you want to start us off.
Sure, thank you. So I'm Vishnu. I'm a fourth-year medical student at Florida Atlantic University. And I'm here today because I was a leader for the Vote Health 2020 campaign. So one of the projects that I was working on as part of this campaign was creating voter health intervention resources for health clinic-based voter access. So that included checking voter registration for patients, being able to register yourself actually through these QR-based resources, and also being able to register for absentee ballots.
Great, thank you so much. Jonathan, do you want to go next?
Sure, I'm John, I'm a fourth-year student. I've been most engaged with Met Out the Vote, which is an AMSA national campaign. Proudly, we worked with VoteER to establish a healthy democracy campaign, which is where institutions got institution-specific QR codes and kind of gamified the act of voter registration absentee ballot request. So I'd say my main area of focus is trying to broaden the definition of healthcare and see voter registration, voter enfranchisement as a dimension of that, and roll out the structures to facilitate that.
Thank you. Anthony?
Yeah, sure. So I'm Anthony. I'm a PA student, second year at Midwestern University in Arizona, where it's like 80 degrees today. So this is the good time to be from Arizona. Yeah, so prior to PA school, I had a career mostly in politics and communications, PR type of stuff. So I had the opportunity to work on Capitol Hill for a member from my state. And then once I got off the Hill, kind of doing more private political communication, things like that. Gave me a really good look at, they say like how the sausage is made, and it is as disgusting as you think sometimes. So, you know, I have a real passion for helping healthcare students, other healthcare students and professionals kind of understand the importance, the absolute extreme importance of being involved in advocacy and being involved in health policy, because helping our patients in the exam room is one thing, but we need to ensure that we're creating a system where people can get into the exam room. So with that, you know, during PA school, I've tried to take every opportunity I could to kind of build on that motto. Working with the PAEA as a health policy fellow, I sit on our state association's board of directors. on behalf of students with a couple other from the schools in Arizona. Yeah, it's been a really good opportunity. So I'm proud to be here. I'm happy to chat with you all. Thanks.
Thank you. That was really well said. Thank you. Caroline?
Hello, my name is Caroline. I'm a physical therapy student at St. Louis University. I'm involved in the American Physical Therapy Association, specifically through their hashtag Fight the Cut campaign that we had this past year. It was the Medicare cut that was supposed to be around 9 to 10%, but we actually got reduced to 3 to 6% for therapy services. So we're very excited about that, especially in the middle of a pandemic. It's good to not to get as high of a cut from our services, and also increases patient access to us so that we can also help fight the opioid epidemic. Some other things I'm involved in is our pro bono clinic here in St. Louis. I serve there in the specialty clinic with the diabetes, pelvic health, and then also the heart health clinic. Thank you guys for having me today.
Thank you all for sharing a little bit about yourselves and the voting initiatives. I'm super excited to get into this Q&A session, so let's jump right in. So I know for me personally, the 2020 presidential election was super chaotic and just really nerve-wracking, watching the numbers, watching states turn blue, turn red. It was just a lot. So what does the outcome of the 2020 presidential election mean for health profession students and health professions education in general, from your perspective? And anyone can jump in.
I can start us off. I think when I was thinking about this a little, it breaks down into 3 areas for me. I think the first is central leadership, getting on top of COVID, rather than having a state-led response, really having some coordinated leadership that is central. That'll do a number of things, which is first to reinstill a little bit of trust in the public, in our health institutions, in our ability to respond to the pandemic, but also will roll out vaccines and allow us all to get back on the wards and really fulfill the experiential components of our education. I think secondly, there will be a greater respect for experts and expertise, facts. We will be living in a shared reality with our leadership, and that I think will do hugely to have the trust again, or of the public, have the public see professionals as, rather than a threat, as a service. And then I think the third is a little bit more logistical, but I think funding will open up in many ways, is often in terms of research dollars, and at least from the med student perspective, that in academic medicine is really valued, and there's kind of a cram in our education on to get scholastic work, and it detracts from the experience. And so I think with a little less of a crush, I imagine the culture of medicine will open up a little bit, be less focused on just purely scholarship, and open up to applied sciences like what we practice, really trying to do systems reform and things like this.
Yeah, I'd probably echo a lot of what was said there. I think, we can't overstate the importance of having, centralized leadership. And I was really happy to see, President-elect Biden take the reins with COVID as one of his very first initiatives when he became president-elect. I think that shows that he trusts science, he trusts experts, and has a good team surrounding him. On that note, though, I will say I think that there's a lot of trust that needs to be rebuilt. I think that the way that the pandemic was handled, you can't blame it 100% on our former president alone. I think that there were some things that got miscommunicated and weren't put out there to the right communities at the right times. And that's something that I think folks need to take a pretty deep look at. Part of the reason I think that happened is that the government wasn't really even fully staffed. So you look at CMS, you look at CDC, other critical posts, even outside of the healthcare realm, outside of HHS. This was a really, really bare bones government for the last 4 years, with many key spots not being filled. I think we see what happens when those key spots aren't employed by talented folks that we know are out there, because a lot of them are sitting in this room right now. So I think there's a lot of work that needs to be done, and it's the next generation of folks like us who it's really incumbent upon us to hold feet to the fire and ensure that that work gets done, if that makes sense.
Yeah, I think that was what amazingly said, Jonathan and Anthony. I think one thing that really stuck out is this emphasis on rebuilding trust in our health and political systems, because it's like this was a time that no one expected and no one knew how to prepare for. And you kind of expect your government, you expect your healthcare professionals to kind of help guide you through these times, and there was a lack of that, right? So are there any other thoughts on this question? Anything else that can be added here before we
Bring
move
up another, just a practical component. It brings up the opportunity for loan forgiveness programs. And I think that, as all of us know, you have to invest quite a substantial amount of capital to be in the health profession. So hopefully Biden-Harris administration will work towards helping us out with that.
Absolutely. And I think that'll be, I mean, not just this, but not just the pandemic, but the Black Lives Matter movement really brought up the fact that we are not a diverse profession. And I say that from a PA perspective, but I agree, the loan repayment program, more discussion around making this profession more accessible. Thank you for adding that.
Yeah, just to piggyback off of that, I totally agree with like the Allied Force Workforce Diversity administration or policy that needs to be passed. I really hope that that goes through. I mean, physical therapy, I don't know about the other professions, but we're 76% white. And so, I mean, and only about 2 to 3% of those populations are African American. So, I mean, we really do need to have ourselves represent more of like what the United States as a whole represents. And also so that we bring to light some subjects that, we've been ignoring for years and years. And then as a result, it's been really detrimental on our society as a whole.
Thank you. I want to also ask the next question, create a little bit of space to discuss this since it's so fresh in our minds. I was actually on my cardiology consult service clinical on Tuesday, and I get pinged from New York Times like over and over. I'm like, okay, what is happening? And then, I start reading about the Capitol building, and what started out as what seemed to be a protest turned out into, I believe it is now 5 people have passed away or gotten killed, I should say. So I was just wondering if the panel could talk a little bit, maybe verbally process what you think happened, what the response was, why we should care as health professional students.
Yeah, I think this is an opportune time to talk about systemic racism. Hugely important for our profession, but endemic in a lot of the structures in our society. And I think that's what, in many ways, allowed the Capitol insurrection to manifest. It's not very covert that it was understood that these insurrectionists were going to be white, and that just fundamentally put them in a different category in the heads of the security advisors, as evident by the security measures taking place when Black Lives Matter demonstrators were around the Capitol. Really jacked up compared to the minimal security lines present for the alt-right protests. I think it's just the clearest indication that at all levels in our community healthcare, but in our nation more broadly, just there still seems to be like a fundamental miscategorization of minority individuals as a separate category of people than white individuals. And I think in many ways that underlined what was allowed to take place.
Yeah, thank you.
Yeah, so, I mean, I'm still struggling, to be honest, to try to put all my thoughts about it into words. I mean, as images continue to come out, as more videos come out, as police officers who were there confronting and fighting in the lines are starting to discuss what was said to them, threats of murder upon them, threats of murder upon our elected officials, all for upholding the principal tenets of democracy in the building where our democracy lives. You know, it's something that's really, it's hard. It's hard to understand how that could happen here, but at the same time, it's not, just given our history. Like Jonathan said, I mean, you look at the two responses that we've seen when there were protests for Black Lives Matter, for George Floyd, peaceful by and large. And this was planned to be violent, you know, from the jump. I'm not saying necessarily everybody there had violent intent, but a lot of them certainly got caught up in it. And it was really sad to see the response in a building that, you know, I used to work. It's funny, like seeing some of these images of where the elected officials are sitting, where they are, and I know exactly the exits that they're trying to get out of. I know exactly where they are in the building, and that used to be like my office, man. Like that's where I used to go to work. So I have a personal attachment to not just the building itself, but to the idea of America. I think what we're supposed to do is learn from our mistakes as a country. I think that it's clear though that we haven't done that, and there's an incredible amount of work to be done. I think we got incredibly complacent when we elected our first Black president. I think folks were saying that racism was over, and wow, how stupid do we look now? So on the one hand, it's a tragedy. It was, you know, an attack on our Capitol, and I think that that's horrendous. Same time, and of course, any loss of life, I'm profoundly sorry for, and I hate it, to be honest. But at the same time, I'm glad that, you know, we know who these are. We know who these people are. We're getting a good look, and we're confronting it on its face. You know, these things can't hide in the shadows anymore. If there's any silver lining, I think that's it. We have to shine a light on it, and if they're going to shine a light on it themselves, then you know, maybe it's easy for us to address as a group of folks. That's just my cursory reflection. Again, this is so hard. It's hard to put it all into words. It's just really, the emotion is just anger and deep, deep, deep disappointment and frustration.
It must be so surreal to have seen those images, having been there, worked there. I can't imagine. So appreciate that contribution to the discussion. I don't think there's a perfect answer to this. I think we're all still processing, like you said, Anthony. So I appreciate all that input. And I want to highlight a comment we have on the chat from Karina, once again, highlighting the stark contrast between the Black Lives Matter protest on the Capitol and what happened recently. So appreciate that comment.
I can just reinforce what Anthony said as well. I'm just talking about American exceptionalism, what we've been told growing up our whole lives. You really can't deny at this point, based on what happened, that there's really deep-rooted issues with this country. And I think that this can be turned into a positive, because now there's just no denying that we have a lot of things that we need to work on. And I mean, that may be the good first step in just getting started on some of that work.
Yeah, I agree. I know one word that I definitely think has been overused over the last 4 years, but unprecedented. But I mean, this definitely was unprecedented. And I think it has shed light on a lot of things. I know a lot of people who've been like hardcore Trump supporters all 4 years, stood beside him through the whole thing. And then this put them over, you know. And finally, now they're admitting that, you know, a lot of things that he does is wrong. So I think that is a silver line that's around it. But still, it really is discouraging that it took an event like this in order for people to really start opening up their eyes.
Thank you, Caroline. That is so true. Are there any other thoughts on like the attack on the Capitol? I also just wanted to add that I feel like, you know, the lack of consequence was definitely the most appalling thing for a lot of people. It's kind of like, you know, when you see as we talked about Black Lives Matter, doing one thing that was actually considered peaceful, they aren't allowed to do that. But then you see a group of people not getting their way, and they're allowed to storm a federal building and kind of get away with it. So yeah, it definitely is disheartening. So thank you for all your thoughts on that. So now that we talked a little bit about election results, what this means for health professions, students, health professions, education as a whole, we talked about the attack on Capitol Hill. While keeping these events in mind, why is it important that health profession students are involved in voting in elections and engage in voting initiatives?
I can go ahead and chime in. So one of the ways I specifically saw it was really effective was this past year. I told you I was involved in Fight the Cut for the Medicare cut on the therapy cap. And a big issue is this went all the way out until the end of the year. And so after CSM didn't listen to any of our remarks, then we had to go ahead and bring this to Congress. So this is where we really matter a lot as voters and as students, because we can have our voice heard at the Capitol through sending letters to them and forming those relationships with our congressmen and women. So, I mean, we need to be involved from like the start to end so that they're not just there when we really need them the most. We need to form these relationships with them and vote in people that, really do represent our values and who will, stand besides us through thick and thin. In addition, I mean, besides, getting to know your congressman, you need to know policy as well. A lot of people, when I was talking about like the Medicare cut to them, they were like, oh, how does that affect me as a student? Like, I have, 2 or 3 more years of school, what is this going to do me? It actually does directly affect students. So to look more into it, part of the cuts would actually affect students being able to do clinical rotations. And so, I mean, that's a big part, and it's already hard to find a clinical rotation during a global pandemic. So knowing really about all of that stuff and how it impacts not just you, but your profession and then the community around you as a whole.
Yeah, I mean, from my perspective, I think that there's 2 real ways to like move the needle in politics, and that's through money or votes. Ideally, you have both, right? But I don't know about you guys, but I'm in just so much debt right now. It's like hard to think about. So we got to do votes, right? That's the next step here. The problem with that is you have to organize. You have to get folks rallied around a goal. You have to build coalitions like this one here that's interprofessional and shows common interest. It's a force multiplier. You just 5x your group of folks who can exert some influence here. It's one of the things that was really I didn't really believe was true. I thought it was kind of a myth. When I went out of college and started working on the Hill, I thought people like writing their congressman, their congressperson was a thing that didn't really matter. But I want folks to understand that there's an entire department within every office that's devoted to constituent mail that gets sent out. And when writing the vote recommendations for the member, the legislative team often pulls what's important in the district based off of the mail that they get. So, one really strong campaign on one specific issue can actually move the needle quite a bit. So that's something that I want everybody to keep in mind. Now, the way to do that is, again, being involved and starting to say yes and educate yourself, become more politically literate in how these things work. And it really does just take saying yes. People want to teach folks how to learn to advocate, how to do these things, how to lead and organize. There's so much support, so many opportunities. So that would be my plug for folks to just, if you're overwhelmed, Google something and say yes to it. I think that's really important.
Yeah, I think I see an ideologic reason why voting is a dimension of healthcare. Whether you want to get involved with voter enfranchisement, but at least participating in the vote. Because I don't have to tell you all, when I work in the ED, the people who I see coming through the door, typically the young, low income, and then those in Black and brown communities, people who disproportionately use the ED to access our healthcare community are the same communities that are disenfranchised from the vote, the same communities that are excluded from the ability to structure our society. And so if our healthcare system is not well designed for these communities and they're voiceless to change it, then I think that begins to construct a professional responsibility to elevate these voices, to vote on behalf of them, and begin to participate in changing the structures so that they can better serve these communities. Because if not, I think I foresee a vicious cycle that without our involvement would be struggle to be broken. But it's a great opportunity for health professionals on behalf of our patients to empower their political voice so that they can participate in how society is structured. And I think we'd see just radically different healthcare, radically different community health, and then new definitions of health that don't require discussing the hospital per se, but maybe start in the community.
Yeah, and I want people to understand that even as health professional students, we still have a lot of social capital. We have a very strong platform to stand on, and voting is in itself a health intervention because it's a way to make policymakers accountable to our communities. And you need to let them know what are the needs, how can we make ourselves happier, healthier, better. And like John was mentioning, there are certain populations that have been historically underrepresented, and we have access to them as healthcare professionals, and we also have their trust because we've worked with them very intimately.
Thank you so much, Vishnu. I think you said something extremely powerful, that voting is a form of intervention. I think a lot of people underestimate that. Like, there's so much power in that. I also wanted to read something in the chat that someone had mentioned. Karina had said it's frustrating that 95% of these people won't face federal charges. This is a privilege because every form for a job, applying for school, loans, etc., ask if you have ever been charged with a federal crime. This allows for people for the rest of their lives to perpetuate a vicious cycle of poverty, unemployment, and not having an education. Thank you for that contribution, Karina. Alrighty.
One last piece I would say on this is, at a lot of health profession institutions, we focus on national policy, but a lot of where health and made is local and state, and a lot of state budgets impact health. So getting involved in one's local community, being aware of ballot initiatives, and then knowing your state representatives and holding them accountable, extremely important.
I can't emphasize that enough. Absolutely.
Okay, are there any other thoughts on that question before we move forward? Okay, Maria, you can go ahead.
Yeah. Similar question, but I think implications for when we come out of this webinar and go back to our peers is, should health professions students have political knowledge or awareness? I have an answer, but I'd love to hear for all of you.
So I would say yes, because like it or not, just being a health professional means that you have a certain platform, a certain voice that people are going to listen to. And you're doing a disservice to yourself and your community if you're talking and not understanding that people are really listening to what you have to say. So because of that, we all have a responsibility to understand the issues that are affecting our communities, in particular, the issues that are affecting the health of our communities. And as we know, that is effectively every political entity and interaction that you have.
I totally agree. I mean, you need to know your community and the people you're working with and know how different policies are going around them are affecting them in order to treat them with the most excellent and best care possible. I mean, a lot of people who don't keep up with this kind of stuff, like, they are doing their patients a huge disservice. I mean, you can have things that could trigger people that you weren't aware of because you weren't paying attention to politics. Or you can go ahead and you could charge someone a whole lot for a session that they didn't need to be charged for because you didn't know what their insurance plan was. So, I mean, as healthcare providers, I think it's a duty for each and every one of us to really be informed about all this and treat our patients in the best manner possible.
Yeah, I mean, obviously, I echo all of the same things that have been said. You know, I think you could be a good provider without paying attention to politics, without having that sort of, and, you know, I'll say policy over politics. I think everyone's entitled to have their own political leanings, but you could be a good provider while ignoring health policy. But you can't be a good healthcare professional ignoring health policy. I think it's one of those things we either work or are going to work, in most of our cases, in the most heavily regulated industry in this country. There are reasons that we said, as far as you know, being more involved in the community, understanding your patients better. That's obviously something that's extraordinarily important. So I won't necessarily dive more in on that, but you have to just know the policy. You have to know how the system works. You have to know what changes need to be made, because it's going to continue to grow and evolve, particularly with this administration. We know that President-elect Biden has a history with healthcare. He has a passion for it. And so it's only going to become more regulated, for better or for worse. And it's something that folks really need to pay attention to stay on top of their career and to stay on top of being a good professional in the industry.
And I like what Vishnu was saying earlier about social capital. You know, with these degrees, we have a new mantle of kind of how we're viewed in our community, whatever size we look at that community being. And I think having a basic understanding of power, and we wield power whether we expect to, intend to, or not. And one's silence on an issue can be just as resonant as one's action. And to have a basic awareness of this, I think, would be important in political instruction and health professional training. And then I think another thing I see often is in the first year, in early years of education, students often feel quite empowered by this new path that they're on. And at least what I saw at my school, and I participated in this, was some pretty unfocused energy where students are very empowered but don't really have the skills to translate that power into progress. So I think there's a huge untapped resource with these skills not being developed and built in health professional education. There could really be an engine for creating change that I think, you know, is yet to be installed.
That's a great addition. I mean, we're the future of healthcare, all of us here on this call. And so setting the tone is so important. I want to just highlight a comment on our chat. Curtis mentioned policy is a population health intervention, and it's important that we can advocate for our local communities. Absolutely. I think everybody here has touched on that. I also want to just add another dimension. Absolutely important to know policy for our patients. I mean, we literally take vows that we will do that. But policy also affects us as students. And if we're not aware of it, we can't change it. You know, one thing that absolutely blew my mind is that PA students are unable to finance their education using Stafford loans at the same level that other healthcare students can. And it's just because the law hasn't been changed, not for any particular reason. No one's gotten around to changing it. So it's things like that that I think if we were aware, we would see change. But if you all have anything to add, I would love to hear it.
I definitely just wanted to add that, like you said, Maria, we are not only advocating for our patients, but for ourselves as well. We need to be updated on what's going on. And just to add that we end up perpetuating the issues we see systematically, whether intentional or not, when we don't go out of our way to learn about systemic inequities and things of that nature and how it impacts the communities we are treating. So yeah, that's definitely something I wanted to mention. Did anyone else have anything to say before we continue? No? Okay. So just to follow up on everything we've been talking about in terms of political awareness and you know, getting involved in voting initiatives as a health profession student, from your perspective, how do you feel political awareness affects your education or your work currently?
So I think all of our training is really tough. And so, and it can be isolating and make one feel powerless. So organizing has been a huge source of energy for me. Feeling that as a way to fight burnout, to try to collectivize, to try to really organize and make change on the communities that I can't make inroads in individually, has been a huge drive for me. Just due to my appearance and the way I identify, the spaces I occupy, I'm very privileged. So I can't say that like I'm disenfranchised or voiceless, but this as an engine for my wellness has been really rejuvenating.
You know, from my perspective, I think that it's my awareness and knowledge of policy, of politics, however, you know, limited, because the sky's the limit. You could spend a lifetime trying to figure everything out. But it helps me train others, which I think, you know, we kind of touched on a little bit with organizing, but I take, you know, immense pride in teaching others how things work, how this system operates, what strategies are effective, which strategies are more of a waste of time. So I feel incredibly blessed to have had, you know, the experience that I have had, because, you know, as a student, again, like everybody has said, we just have so much passion for things. I was so impressed with on my campus over the summer, you know, folks really taking the issue of, you know, racial equity, particularly in our profession, and running with it. And I want to help focus that energy, as Jonathan said, so that we can make those changes, because they are needed. And I think what we're seeing is that, you know, younger generations of folks that are coming of age now and entering the workforce, this is a part of who we are. Like this is part of our identity, and it has had to be that, because look at the world we grew up in. War, my entire life, we've been at war pretty much. We lived through 9/11. We lived through the worst economic collapse since the Great Depression. We have seen horrific racial violence. We've seen so much turmoil through our life that we just realized it's not something that can be ignored. And even little things. I mean, college is the most expensive it's ever been. We all have student loans, I'm sure. And those things are depressing to our prosperity. So it's not really a choice that we get to make as young folks to have an interest in it. I really do believe that it's part of our generational identity. It's something that has to happen. So I again, I love that. I love seeing people fired up and ready to go and wanting to do all this work. And I hope that the folks on this call are you know, wanting to help cultivate some of those and create that pipeline of the next generation of leaders, because there's so much to build upon.
I can just add that even just as a clinician, just knowing what's going on with your patients is very important. Like John talked about in the ER, all the issues facing your patients. Anthony talked about just the complexity of healthcare policy and just being a patient and trying to navigate that system. Part of being a clinician is also knowing like what else is impacting the health of your patient besides the medical issues that are right in front of them. And in order to do that, you really do need to know what's happening in your community, what's happening at a local, possibly a national level, given the COVID-19 pandemic. All of this plays a role in our care.
I definitely agree. Knowing a lot about this, especially political issues and other cultural stuff that's going on in your community, can also help you open up your eyes to some of the stuff we're taught in our various professions as well. I know that we have brought to light some test and measures that we do that might be biased one race towards the other that we weren't aware of before, and now that's been opened up. For instance, like there's a manual muscle test that we've done, and now we know that, it's actually a very triggering position that we put it in for certain minority communities. And I know there's also been a lot of like dermatology test and measures that, have more research that's been put into them because, like they've only been studied on one race versus the other. I think having our eyes open to these kind of issues is really important. And so that we know that we're not biasing like one population over the other. And it also helps us, make people more comfortable to approach us as healthcare professionals if we're aware of these different things.
Exactly. Thank you for that, Caroline. I just wanted to point out something that Jonathan had mentioned earlier, kind of like this idea of using advocacy to kind of fuel yourself, because as health professions students, we do go through burnout. Like it's a lot that we're going through day in and day out. And there's a way we can redirect that energy into something that we're passionate about, and that could be voting initiatives and working within the communities. And also the idea of feeling powerless within the healthcare system, but realizing that there's so much power in working in the community and learning more about your communities. So I think that's something important to note. I do want to go into the chat and just look at some comments that have been posed before we go into the break. Curtis mentioned that policy is a population health intervention, and it's important that we can advocate for our local communities, and that is amazing. Tiffany mentioned that medical and health professions schools are social justice training grounds. Therefore, education in all of these areas need to be and should be woven into our education. Yes. Carla mentioned that the recent presidential election and the riots that ensued concern me in terms of others using protests, threats, and violence to overturn public health decisions. I have a recent example that occurred this past week in Arizona. And I think I see one more from Meryl, or two more actually. So this might be a question, so I'll save that to later. And I think there's one more here. Even more recently, Pulse Ox is biased towards dark skin. Thank you for that, Karina. Alrighty, so we're gonna turn into the break and come back with more questions and more discussion with our panelists. So yeah, get some water, stretch. We'll see you in 5. Alrighty, so I think we can get started again. I hope everyone's back from the break. Hope we didn't lose you. Okay.
And just as a reminder, there's a Google form link on the chat. We'd love it if everyone had a chance to fill that out. And we really appreciate all the comments coming in.
Okay. I'm just gonna wait for our panelists to come back on, and then we'll get started. I think we're just waiting on Anthony. I'm not sure if he's, okay, perfect. Thought we lost you. Okay.
I was here the whole time. I just didn't realize my video on. Whoops.
Okay, perfect. Alrighty, so we'll get right back into our discussion. Okay, just give me one moment. Okay, so I know before the break, Jonathan mentioned the fact that, you know, you're seeing passion in students, but there's kind of like this lack of skills being built within the health professions education. So the question I have for all of you is, can you provide some strategies for health profession students that want to get involved but don't know where to start?
Yeah, I would say a great place to start is within your professional associations. I know, I mean, that's just my experience though. I've gotten very involved in the American Physical Therapy Association, and a lot of these associations have state chapters as well, because I know we talked about earlier about getting involved in your local community. So I'm also part of the Missouri Physical Therapy Association. And then within that, like there's an Eastern District Association. So by getting involved in those things, you really get connected with people who, you know, have experience and know what they're talking about and can put you in the right direction. So I think that would be an excellent place to start, because those have the primary resources. Another one would be talking to professors. I know right now, like there's been, you know, a big jumpstart in like trying to get education, trying to do education measures that are, I can't talk right now, but they have resources within like research and other areas as well that can really open up doors for you and find out exactly what you want to do.
And then there are a number of national organizations that I would just shout out to. So one is Med Out the Vote. And this is mainly focused on institutionalizing voter readiness, things like ballot awareness and registration. So if that's something you're interested in, maybe after this, they'll send out an email and I can include some emails to reach out to there. There's also VoteER. This is similarly trying to institutionalize voter registration in other healthcare spaces and providing resources to do that. So those are two big ones that I can think about. I would also encourage anybody to reach out to their League of Women Voters chapter. They're typically county organized, and they have more than enough opportunities to really engage in the political process in a nonpartisan manner. It's a great way to build skills and really gain an awareness of the space. So that would seem like an entry-level thing.
Yeah, so I think one of the best things that you could possibly do is find a candidate that you like or a ballot initiative that you're passionate about and join the campaign. Just volunteer for the campaign. You will meet tons of people who, you know, a lot of this works. There's like folks who live next door who you have no idea, but they're the chair of your, you know, county's party or something. It's just like, I had no idea that you live next door to me. So you only get exposed to those folks if you join campaigns, if you put yourself out there. Volunteers are always needed, and you will be put to very good use. And nobody gets to escape phone banking, and it's something that everybody needs to do, and it's extremely valuable. Knocking on doors is one of the most enlightening experiences that you can have. It's one of those things where you are confronting voters face to face, and you really learn how to deviate from the talking points that you've been given in your canvassing packet, and how to engage with people and tell them why this issue is important to you, or why this candidate is the best candidate. So I really, regardless of party, whatever it is, I think that one of the best ways you can educate yourself in politics is joining a campaign.
I can just echo what everyone else has said. I would just say, number one, just find something you're passionate about, and then just talk to as many people as you can. Look on the internet, just use everything that's within your resources and your network, because there's definitely people that are trying to do the same things that you're trying to do, and you're a lot stronger when you work together rather than people working on their own.
I appreciate that. And I know you've all been involved in different initiatives that we'll hopefully email out to afterwards. And if anyone else in the audience has initiatives that they're a part of, they know, feel free to add it to the chat. I think we're networking here too. So kind of on that note, with everyone participating, how do you feel about the different health professions working together on these issues? How do you envision that happening?
I think that it's of critical importance. So I'll give like a little bit of an example from my old life prior to all of this. So I used to be a lobbyist in the state for labor unions. And those can be pretty contentious between the different groups. So, I worked with plumbers and pipe fitters and electricians and the building trades and all that stuff. And there's kind of some nice little rivalries among all the different labor organizations. However, we were one of the most effective coalitions in the state when it came to elections, because they all realized, every member, it was very important in every union to be educated on how policy, how advocacy can change their profession, and B, that everybody, despite all of their rivalries and all this, we're all working towards the same goal, and that was a safer workplace, good wages, and being able to, live a good life and provide for other working families. I really do see a pretty perfect analogy there with healthcare. Where obviously some folks are in unions and not, but regardless, I think that coming together in your state in particular, so getting involved in your state association and really pushing for coalition building among the docs, among the nurses, among the PTs, the OTs, the speech therapists, all of those folks, because we really all have one real common goal. And if you can unify around that single message, again, I kind of talked about it earlier, but you're 10xing yourself, and people will be forced to pay attention. That's how you build political capital, and that's how you start to achieve victories. You have to do it as a group. Unless you're the AMA and you have so much money and so many lobbyists and all that stuff, it's just a way to do it. You have to build coalitions. And I really do think that that's the best way for us to succeed anyways. We all need to lift each other up and provide for our patients.
Yeah, I think that's well said. I think we need to move beyond money in many ways. A microcosm of this perhaps is happening in a lot of MD professional societies, where people may still be involved in the AMA, but they say will be much more involved in their optho society and try to garner some foothold for optho and their reimbursement. And I feel like that can happen in a larger way with other professional roles. And so we need to recognize our shared values and go deeper than just the dollar and try to cut out turf, and understand what is a new way we can envision this system, and where it's bigger than all of us, where can we help? Where are we best suited, working at the limits of our licenses, and then build that coalition.
Thank you for that, Jonathan. And I also want to just make a note that, the space that we're building right here, that's how it starts. It starts with a conversation from, individuals from different health professions coming together saying, hey, this is a problem. How are we going to fix it? What are we going to do about it? So I just want to just take the moment to say thank you to all of you here right now, because this is what is going to be making a difference in all of our fields. And I think this works perfect with our next question that we have. And it's, what do you hope to see improve in the healthcare, or in your professions with the new administration?
I can say on my end, so being from Florida, something I'd really like to see is Medicaid expansion take place. So at Florida, Texas, Georgia, all non-Medicaid expansion states, and they've all just had people elected to government who are running on ideas of supporting the Medicaid expansion. And I think that that's one way that we can really, really help improve the health of Florida, of Texas, of Georgia, and just a lot of people very quickly.
Specifically within Missouri, I would really like to see direct access finally go through for physical therapy, for physical therapists, so that we can really be able to, see those patients without getting a copay, and so that we can increase access to more people throughout the healthcare system. I know we were just talking about before about us all kind of working together. I really do think like issues like this is very important for us all to understand what our roles are. And I know I've had a lot of those conversations about specifically talking about direct access, that, different healthcare fields might not exactly know what a physical therapist does. They think we do the same thing as an occupational therapist and our education behind it. And I think through having platforms like this, we really do open up the conversation and we get to understand what each and every one of us does. So that's the issue in Missouri, but then nationwide, I really do hope that the acts go through so that we can start getting stipends and loans for our healthcare professional schools, so that we can start increasing the diversity within each of our professions.
I mean, perhaps low-hanging fruit, but I want someone to start taking the COVID pandemic seriously up kind of from the highest office. So a lot of our change from the MD perspective is going to be stifled if people aren't feeling safe, coming to the offices, coming to the hospitals. I'd like to see funding and energy for innovative care models, whether this is a continuation of telehealth or continuing to be creative in how we can render care. I think this model of waiting so far until diseases manifest and then coming to the hospital and then having a poor transition of care out of the hospital to be bounced back to the hospital needs to stop. And so I'd really like to see energy for moving healthcare more into the community, more proximal, and improving those transitions of cares if and when people need to come to the hospital.
Yeah, to piggy off of that, I mean, we've got fires in the kitchen right now, and I want to put those out. I think that that's really going to probably take up a bulk of the time and attention in the first 100 days in particular. I guess one of the specifics on that end, especially as a future PA and a current PA student, I would really like to see the Biden-Harris administration extend the public health emergency. Right now it's set to expire late April. I think that, PAs have kind of been able to step up and prove a lot of worth in the healthcare system and providing affordable and effective care. I think by expanding that, at least until we're kind of through the pandemic, would only serve to kind of increase resources for patients, not just by making PAs more available, but for everybody. So I think that those resources need to be extended, obviously, a competent vaccine program, and a federal government that has an interest in taking the reins and coordinating care among the country. So that's something that we haven't seen, and it's been sad.
Thank you for that, Anthony. I see some messages in the chat
Yeah,
here.
there's some good stuff in there.
Did you want to highlight that, Maria?
Sure. I want to scroll back up to Meryl's comment. I'm a professor in a PA school. I think that most medical professionals have no idea why Black and Brown communities are distrustful of the medical profession. A lot of people know about the Tuskegee study, and that's their entire education on the topic. Medical professionals attribute the mistrust of lack of education on the part of the public rather than our own lack of education. I've been reading the book Medical, I can never say this word, y'all, Apricite. And we need resources like that as part of our curriculum. Totally agree. Karina mentioned even more recently, post-sexist bias towards dark skin. Allen's, I hope I said that name right. We need politicians to take political decisions. However, healthcare professionals should influence decisions of politicians. Political awareness among health professionals is a must. At the end of the day, everyone is suffering from disparities, though more impoverished communities. And then Grace, thank you for providing this platform. I'm a first-year PA student and I was previously an RD, so I've been able to dip my toes in what Ascend, Academy of Nutrition and Dietetics, it's been a long week, y'all, and the AAPA. It's interesting to see how much similarities both professions have. Passion about preventative health and food insecurity, yet a lot of PAs don't even know the difference between dietitian versus nutritionist. Nevertheless, Ascend alone. Imagine what could happen if both associations and much more could come together and tackle this issue that is so relevant in all professions. Thank you for providing the insight, Grace.
Yeah, sorry, real quick, if I could just throw a shout out to RDs. My wife's an RD, and it's been incredible to get the source of her knowledge, particularly during rotations. So if you aren't familiar with RDs yet, get familiar because they're a tremendous resource. Beyond just working on the wards, they do a lot outpatient as well.
Awesome, thank you. So I think one thing that we mentioned for this webinar is looking to draft a letter for the incoming administration of what our priorities are as healthcare students. And so this next question touches on that. From the perspectives of each of your professions, what do you think is the most pressing issue that the Biden administration needs to address within the first 100 days?
I think John mentioned it. It's low-hanging fruit, but it's definitely probably the first thing all of us thought about. It's addressing the COVID pandemic. Right now, we have a vaccine, but its mechanism of distribution is dysfunctional. And that's something that's a huge issue for all of us in health professions and just the general community at large. So definitely just trying to understand how we can make this vaccine distribution model a little bit more efficient and just be able to protect all of us as soon as possible.
I second that too. That's what everyone thinks about the next 100 days. What are we going to do? I really do hope we're able to get 100 million vaccines in 100 days, or I think that was what he said. And also, we really do need to address minority communities and get these out to them as well. I know particularly like even at my hospital that I work at, I was shocked that, you know, a lot of like the higher ups staff there got the vaccine before some of the technicians, the people who were, you know, like with, you know, directly with the patient the most and really have the highest exposure. And when you kind of look at that, you look at payrolls and, you know, some people got it before others for certain reasons. I know that the CDC had put out guidelines for everyone, but then, you know, it was up to hospitals and states to administer those. So I think that really does need to be addressed in the first 100 days and get these vaccines out to like the people who really do need them and who really are like frontline workers and working with people all the time.
Yeah, I mean, 100%. I think we've all kind of found consensus here that, you know, COVID is the thing that's most important. So again, just trying to expand that public health emergency until beyond April, I think will be really important to freeing up resources for patients. You know, beyond that, I think that there's something that we can all do that I've been sort of disheartened to hear a lot of providers that I work with, whether they're preceptors or, you know, friends who work in healthcare, talk a lot of kind of like anti-vax type of stuff. I would just challenge everybody to do some compassionate education and push back when you hear your colleagues talking about that, whether that's students, preceptors, et cetera. This really only works if folks get vaccines and the data is there. So I personally don't really tolerate that, and I hope that other folks are willing to kind of speak out against it too, because if we're not able to address that, if we're not able to find consensus as a healthcare community, how are we going to expect patients to believe anything that we say? I think that's been a huge, huge problem in COVID, is fractured communication coming from all different directions. So again, just one of those things, just compassionate call outs when it's necessary.
I like that, compassionate call outs. I'm going to have to adopt that.
Any other thoughts for the first 100 days? I think I see something in the comments here. Let me start with Diego. He said, he or she said that probably won't happen in the first 100 days, but we need to make sure healthcare is no longer tied to employment by providing a robust and affordable public option. And then Mackenzie said, I'm hoping that the Biden administration launches widespread vaccine education, either from the government or through their medical advisors. I know many, even healthcare professionals, that are refusing the vaccine for lack of education or misinformation. My intention is not to devalue anyone who chooses not to get a vaccine after being properly informed. I'm interested to hear what you all think as well. And I guess that will be a question that we can talk about later on. So any other thoughts before we move on to audience questions? No? Okay. So now it is time for Q&A from the audience. So if anyone has any pressing questions, please type them in the chat, or you can even call out.
I want to throw one out there. If you all want to talk about something that gives you hope, we've talked about some heavy things, but I also want to know what brings you the smile to y'all's face, what gives you hope for a better future.
I mean, without getting too corny, quite frankly, like events like this, they give me a lot of hope, they give me a lot of energy. It revitalizes you in a sense, because we do acknowledge and see so many problems in the line of work that we're going into, but you also meet people and you're just seeing a really large resurgence, especially in our generation of healthcare providers, of people who want to do things better, who want to really serve our patients in the best way we can. And I think that there's a lot of energy, and I've met so many people just through advocacy efforts, and they just give me a lot of pride to have worked with them. And that makes me hopeful for where we're all going to end up.
Yeah, I think as we approach inauguration, a lot of the messages and stories about resilience and reconciliation, of just acknowledging like this is not normal, it's not okay, our response to the COVID-19 pandemic, our reckoning that we're having in our country, and just seeing perhaps changes of hearts, but at least coalition building around like, we don't want to live like this. And those kinds of stories just give me hope, because they resonate with me. And it makes me feel, especially when I see young people involved, like at the high school or college level, I really feel like our generation, as we enter the healthcare workforce, there's just going to be a new understanding of dynamism, of how long it takes these structures to change. And if it's not working, we can change it. And just that thinking, not assuming the path dependence of our current system and that people built it right, because we know now that they didn't, that gives me a lot of hope when I see people questioning and moving and having their voices heard.
I think the new administration definitely gives me a lot of hope. I mean, the cabinet that Biden and Harris have already put together has been remarkable and most diverse that we've had so far. So, I mean, just as those have been rolling out, that has really been giving me a lot of hope moving forward. And in addition, this is just a little thing. When I got my COVID vaccine, it was I just had like, that air of hope. I hope that it actually does work. I've never had that most of like a emotional response to getting a vaccine, but I really hope it does work and we do start educating more people and find out more about what this is exactly.
Yeah, 100%, Caroline. Getting the vaccine was, it felt like breath being injected into my lungs, to be honest. Like it was really nice. And Cher, I hope it works, man. We'll see, and I hope that it's widely available to folks soon. That definitely gives me hope. But given the events of last week, just the tremendous trauma that I think all of us witnessed, and some more than others, I guess I have. This is probably a little corny, also, but the building still stands, and democracy won. That really does give me hope. I mean, I'm like a weird political nerd and have always been that way, but I really do believe in America as an idea. I think part of that is, like I said earlier, that we have the ability to be flexible, to adapt, ideally to come to a reckoning, and try to make those changes. I think that's really what democracy is, and that's what this experiment is. So I do have hope for the upcoming administration. Again, like honestly, it doesn't even really have to do with anything partisan. It's just professionals. It's folks who want the job, who want to do the job, and have a demonstrable love for this country. That to me brings a lot of hope, given some of the chaos that we've had to endure for 4 years, 5 years, even longer, but in particular the last week or so.
Thank you for that, Anthony. I see more questions here. Karina asked about getting the information that Jonathan mentioned about, or all of you mentioned about, the voting groups that you've all been a part of. And we'll definitely send out an email. We'll organize that later. And another question here that reads, could the panelists talk about how they practice self-care and avoid burnout while engaging in advocacy work? I think that's a great one.
I can start. So I do think someone touched on it a little bit earlier, but I do feel like advocacy work in itself does tend to combat burnout. So a lot of what I'm doing in my medical school, it tends to be with pipeline programming, working with middle school and high school students, teaching them as part of a diversity and inclusion initiative, as well as a public health initiative for Palm Beach County, which is where I'm living right now. And one of the ways I sell that to my classmates is that I tell them this is something that helps you keep perspective in your medical education, especially when you're in your preclinical years, when all you're doing for an MD student is you're in your textbook, you don't leave the building. It just lets you see people, lets you see the community. And for me, that just really gives me a lot of energy. It makes me just understand why I'm doing what I'm doing. And that more than anything, it really gives me that sense of just well-being and wellness that, it's the reason why every day I do what I do. It's nice to just be able to see that when I come into work every day.
I know I'm not a panelist, but I just wanted to add, just jumping off of Vishnu's point of kind of reminding yourself why you're doing what you're doing. Being a Black woman pursuing a medical degree, there's a lot that comes with that. And it just reminds me that I'm fighting to be in certain spaces that, certain people might not want to see me in, but I'm going to continue to fight to be there. And being a part of spaces like this, I am cultivating a space where people in future generations might have an easier pathway to what I'm doing. So I think that's what definitely gives me hope and what pushes me forward, even when I feel like, I'm tired of this, but it has to be done and I'm gonna do it.
I love that. I think with this work, there's kind of a whiplash that can occur, especially in these last 4 years. So one thing that I find really helpful is to write it out, just to get ideas on the page so that I can return to them, so that I know, like that guiding light, like what was I thinking, what am I going towards? There can be self-doubt, there can be just events that feel defeating, and rather than being consumed by that, if I can either get those out, help process them, I would say writing is a big part of the way I walk through the world, and definitely comes into this work.
I'll chime in because I do the same thing. So writing's a huge part of how I process things. I think like Joan Didion has a quote that says like, I don't know what I think until I write it down. And that's exactly how I am. I mean, when we're doing charts, I prefer to type it out instead of dictating because it just flows better. So for whatever reason, when I'm, writing, things just kind of clear up in my brain. Because this work can be really exhausting. I think days like today, events like this are those kind of reminders of why you do the work, when you kind of can look out at all the names that are here, all the panelists, and hear folks, and the work that they're doing is extremely inspiring. But I don't want folks to think that that's all that this is, because it's not. And a lot of times you're going to lose many more times than you're going to win, and you're going to encounter roadblocks and barriers. And particularly at the federal level, something's not going to happen for maybe a decade. You'll be introducing the same bill. In the state, you're going to deal with legislators who really don't have the time to know what's going on. They rely heavily on their lobbyists. And if that lobbyist, has their ear, that could be it for you. So there's so much losing involved in this type of work, unfortunately. But I do think it's important for folks who have that passion to understand and identify a way for them to keep themselves going. When I have those losses, I get frustrated and angry, downright angry, and I just write op-eds that I keep to myself. No intent to submit them or anything like that, but just write out the argument and make me feel good about it. At least I can see the moral high ground and I can feel good about it. For folks who do like writing, there is a group that I found during COVID that I was doing for a while. This is like a healthcare writing group in particular. It's for students and providers. If you Google writing medicine, I believe it's Laurel Brightman is the organizer. I think you can sign up on her website. It's run through Stanford, but writing medicine, it's been awesome. She's a great writer. She kind of helps hone some pieces. And you get prompts throughout the day. She gives you, it's like an hour and a half, I think, and you get 3 or 4 prompts to just kind of jot down some ideas, and then people share. So it's been really cool through COVID to hear other people's stories.
Great, and I think Tiffany dropped the link there, so I really appreciate that. Grace says, going off of what Vishnu and Tiffany said, I'm currently the diversity chair in my PA class, and I host a monthly diversity series where we talk about various current events, and it's been really healing and awesome hearing everyone's perspective. It's also been really nice to hear my classmates outside of class because our program has been predominantly online.
Thank you for that, Grace. I think we have one final question before we can wrap up for the evening. I see here, how do you think healthcare providers can rebuild trust in communities that have historically been disenfranchised?
I think, so this is huge. I think MDs primarily have a problem of thinking we know the answer. So we like to try to lead a lot. I think with all communities we serve, and especially those that have been disenfranchised, elevating their voices is a critical process in making change. Rather than us prescribing what we think they need, really trying to source problems and solutions from those communities is going to be necessary for building trust. And I think it's just a better approach to change making than what we've seen in the formation of our healthcare system. So really trying to listen from these communities what they need, and then marshaling the huge resources that we have, medical knowledge and otherwise, to facilitate those needs, then I think that's a way forward to build trust.
And Jonathan, I mean, what he's really talking about is grassroots leadership, and we really do need that within our communities. We need to find out who those leaders are in our communities and have them guide us, as he was saying. I've been part of a lot of this work both here and then also abroad. And really what we do, a lot of people listen, some people don't. but we also need to act on what we're with the patient in which we're working with. I know a lot of patients, they get discouraged because one person tells them something and then it gets, off the vine pole and no one ever does anything about it. Through having conversations like this and like through voting, like we were talking about, and through, advocating like within whatever clinic, hospital system, community network, wherever you are, actually like listening to your patients and getting stuff done. So I think that's a big part where people actually feel heard instead of just listened to.
Any last thoughts before we wrap things up?
Yeah, so I mean, on that note, I recognize that this has pretty much been the face of oppression for as long as history goes. So I think that it's incumbent on folks who have historically done some of the hurting to practice incredible patience with our patients. Do that listening, but really just with patients, it can be frustrating when they don't do the thing that we have prescribed, or they don't take the medication or any of those things. But we have to understand, I think, and we're starting to understand the multifactorial reasons why a patient is quote unquote non-compliant. I think that takes incredible patience, and we have to continue working with folks and working on ourselves in order to make that difference. I do think it's one of those things that we have to take upon ourselves as individuals in the exam room, in the hospital, and really prioritize it as a part of who we are.
Thank you for closing with that, Anthony. Well, I think this has been an amazing experience for me, especially, but we are going to close out now as much as I don't want to, and I know you guys don't want to leave me on this Friday, but yes, we're going to wrap up.
Yeah, so thank you so much again. Special thank you to our panelists. I look forward to any books or op-eds that are out with your names on them. Thank you for taking the time, everybody, to join us this Friday evening or afternoon for some of y'all. I just want to remind you all that we really do plan on doing the write-up to send to the Biden-Harris administration. So we hope that we can get some of your institutions or groups that you're part of to sign off on that letter. So keep an eye out for that email. We've also given a reminder of that link to the Google form that we hope you all have a chance to fill out. Thank you, everyone. It means a lot to see you all here.
Yes, and one final note, there will be an email sent out regarding how to access the recording of this event. We are going to be hosting more webinars every quarter, so please stay in touch with us to find out more about that. And we'll send you information about the Biden-Harris letter, the draft of it, and just to get you to sign off. And lastly, we do have a group chat that we made just to keep the conversation going so that we can connect outside of this space, because it is important, as we've been talking about all webinar, to keep in contact and keep fighting together for all the goals, all the things that we want to see within our respective health education sectors. So I'm going to post the group me right here, and if you'd like to join, please join, and we'll see you guys next time.
Thank you.
Thank you all for your time and attention.
Thank you. Have a good night.